Today, we begin with a development that's creating quite a stir across South Africa. The South African Social Security Agency, better known as SASSA, has confirmed a grant increase. But before you celebrate, here's the twist: the increase is not for everyone. In fact, only a limited number of beneficiaries will receive this financial boost. That's right, while many had been hoping for a blanket rise in their grant payments to help cope with the ever-rising cost of living, only select individuals will see an increase in their monthly disbursements. Welcome back to the channel, your home for the latest updates on social assistance, pension programs, and breaking financial news in South Africa. If you're new here, make sure to hit that subscribe button and turn on the notification bell, because here we provide vital updates that directly affect your income, your household, and your future. Now let's dive into the details of this selective grant increase, who it affects, how much the increase is, why the decision was made, and what this means for millions of South Africans who won't be seeing any additional money in their accounts this month. The latest announcement from SASSA has made headlines for both good and frustrating reasons. In a recent press briefing, SASSA confirmed that several grant categories will receive an increase in their monthly payments, starting immediately. However, the increase applies only to a small subset of recipients who meet very specific eligibility criteria. These increases range from as little as a 20 to as much as a 100, depending on the grant type and the individual circumstances. This has brought a wave of mixed emotions across the country. On one hand, those who qualify for the increase are breathing a sigh of relief, even if it's only a modest amount. On the other hand, millions of others are expressing disappointment and frustration after expecting a more inclusive increase. Many had assumed, based on government statements last year, that all grant categories would be reviewed and potentially adjusted to match the rising cost of food, transport, and electricity. Instead, what they got was a targeted approach, leaving many to ask, why them and not us? So, who exactly is getting this much talked about increase? According to SASSA's official statement, the grant increase has been approved for the following categories. First, elderly South Africans aged 75 years and older will see the most significant increase. Their monthly old age grant is going up by a 100. Government officials say this is in recognition of the increased vulnerability and the higher cost of healthcare, transport, and other essentials for those in advanced age. This group is often at higher risk of poverty-related health complications and limited mobility, so the boost is designed to provide a small cushion of comfort. Next, we have recipients of the disability grant. For this group, the increase varies based on their level of disability and household circumstances. Long-term disability recipients who have no access to income or support are being prioritized. Their increase ranges between a 50 and a 90. This decision aligns with recommendations from social policy experts, who have long argued that people living with disabilities face higher day-to-day costs, including special transport, medicines, and accessibility needs. The third group benefiting from the increase is foster families. Specifically, foster parents in remote or economically depressed areas will receive an additional A60 per month for each child under their care. This increase is aimed at helping families that are supporting children in difficult conditions, whether due to abandonment, orphanhood, or social services placement. Then we have the war veterans, a category that has dwindled in size over the years but still holds symbolic and historical importance. These individuals will receive up to a 100 more per month, in what the government describes as a gesture of respect and support for their sacrifices. Finally, households receiving the care dependency grant for children with severe disabilities are also included in the increase, but again, only under specific conditions. If the household income falls below the government's ultra-poverty line, they qualify for a 60 monthly top-up. SASSA emphasized that these cases were flagged due to urgent humanitarian needs, often involving children with complex medical issues requiring full-time care. You might be asking yourself, why only these groups? Why wasn't this increase extended to everyone, especially considering how difficult the economic situation has become for all low-income South Africans? SASSA has provided a clear, though controversial, answer. According to their spokesperson, the government's current approach is to implement a targeted relief strategy. What that means is this: instead of spreading limited resources thinly across all grant recipients, they're directing the available budget toward the most vulnerable individuals. The rationale is based on recent data collected by the Department of Social Development, which identified older seniors, foster families, and persons with disabilities as facing the highest levels of poverty-related hardship. SASSA claims that these specific groups are more likely to suffer from malnutrition, displacement, and healthcare barriers. By increasing their grant amounts, even slightly, the agency hopes to reduce those risks while keeping within the limits of an already strained national budget. However, this decision has not gone down well with everyone. In fact, the backlash has been swift and passionate. Civil society organizations like Black Sash and the Social Policy Initiative have released strongly worded statements condemning the selective increases. According to them, all grant recipients, regardless of category, are suffering under current economic pressures. They argue that the cost of essentials has risen dramatically over the last 2 years, while most grants have remained virtually stagnant. On social media and in interviews with the press, ordinary South Africans have voiced their disappointment. Senior citizens under the age of 75 have said they feel ignored, with some saying they didn't know age discrimination could apply to a pension. Parents who rely on the child support grant, which still sits below our 550, say the government has once again overlooked their struggles. For unemployed youth receiving the SRDR 350 grant, there was hope that a review might bring some relief, but this latest announcement makes no mention of them. The government has responded to the criticism by reiterating the fiscal pressures it's under. According to Finance Minister Enoch Godongwana, South Africa is walking a very fine line. The country's debt is ballooning, the tax base is shrinking, and public demand for services is rising faster than the economy can support. Given these constraints, Treasury officials argue that they simply cannot afford blanket increases to all social grants. Instead, they've adopted what they call a priority-first model. This involves identifying and supporting the most at-risk populations first, with hopes of expanding support as more funds become available. But critics argue that this model overlooks the everyday reality of poverty in South Africa, a reality where families are skipping meals, informal workers are earning less than R100 a day, and school children are going without basic supplies. This selective increase could mark a new phase in how South Africa handles social assistance. Rather than offering universal grant increases or rolling out large-scale basic income support, the government may be shifting toward a two-tiered system, one where priority individuals receive higher amounts, while the rest remain on outdated levels. This has serious implications for future proposals, including the much-discussed Basic Income Grant, BIG. If implemented, many believe the BIG would follow the same model, available only to those who pass strict means tests or fall into ultra-poverty categories. This goes against earlier hopes of a universal monthly payment for all unemployed adults. In other words, if you're not already considered high risk, don't expect a major financial increase anytime soon. If you think you may be eligible for the grant increase, especially if your circumstances have changed recently, there are steps you can take. First, visit your nearest SASSA office and inquire about reassessment. Bring documentation proving your new status, such as medical records, proof of income loss, or guardianship documents if you've taken in a foster child. You can also call the SASSA toll-free number or check their website, which has been updated with eligibility criteria for the May and June 2025 payment cycles. Be aware that reassessment may take a few weeks, and there's no guarantee that your application will be approved. However, if your living conditions have worsened or you now care for a dependent who qualifies, you may have a strong case. If you're among the millions who feel excluded and frustrated, you're not alone, and your voice matters. Several NGOs and civil movements are rallying around the issue. Black Sash, Equal Education, and others have launched petitions calling for urgent adjustments to the Child Support Grant and SRDR 350 payments. You can support these movements by signing petitions, contacting your local representative, or joining peaceful demonstrations. Change often starts with public pressure, and history has shown that united voices can lead to policy reversals. With the 2026 general elections approaching, social grants are once again becoming a central political issue. The ruling ANC has made numerous promises around poverty alleviation and social support, and this latest move could either help or hurt their standing, depending on how the public reacts. There's already talk that the opposition will use the selective grant increase as evidence of the ANC failing the people. Whether that narrative sticks or not will depend on how well the government follows through on its promises in the next 12 months. To wrap it up, SASSA's latest announcement is a bittersweet one. For those who qualify, the increase offers a little breathing room, a small but important cushion in difficult times. But for the majority who were left out, it's a reminder of how far we still have to go to build an inclusive and equitable support system. If you found this update informative, please like and share this video so others can stay informed. And don't forget to subscribe to our channel, because we'll be watching this story closely. From policy changes to political promises, from grassroots campaigns to your rights as a citizen, we'll be here to break it all down. Let us know in the comments, do you think this selective increase was fair? Or should SASSA have done more for everyone? Your opinion matters, and it just might be the beginning of change. Thanks for watching, and until next time, stay informed and take care.